So Janice will demonstrate diaphragmatic breathing. One of the biggest benefits of diaphragmatic breathing is that it increases mobility of the thoracic and lumbar spine as well as the entire rib cage because it relaxes the lumbar and thoracic erectors as well as the oblique abdominals. A lot of times gripping of the oblique abdominals as well as the erectors locks down the rib cage and decreases the ability of the rib cage to move. That's where we get into a lot of these upper airway breathing and neck breathing patterns. So Janice will place her hands on the rib cage, specifically the lower rib cage, to enhance and encourage rib cage mobility. So she'll breathe in and breathe into her hands, and the abdomen should rise. As she breathes out, the ribs will come back together and the abdomen should lower. So Janice will perform several repetitions of this, and we can even do a couple minutes of this depending on how tight the person is holding themselves and how restricted the rib cage actually is. Moving on from here, we can actually go into now a quadruped position. So Janice, I'll have you go into a quadruped position. And then I'll have her place one hand behind her head. And now Janice is going to perform trunk rotations. So once the mobility has been increased through the breathing, now we can start to increase specifically rotation through the one arm stabilized and the trunk going through a rotation motion around that stable arm. One of the key components of crawling in infants is to stabilize an arm and move the spine around a stable arm. That's what we're trying to recreate with this motion here. I'll have Janice perform 5 to 10 repetitions per side and then switch to the other side as she gets more and more mobility. She'll perform a couple more on the other side. I want to make sure that she stabilizes through her serratus, keeps the scapula stabilized on that down arm, and her spine should remain in a neutral position as she goes through these trunk rotations. The next pattern I'll have Janice perform are standing pushes and pulls. Pushes and pulls will also increase thoracic mobility. And I'll have Janice perform these while stabilizing one arm on a stability ball. Again, bringing into the context the stability through one arm as we're rotating the trunk around a stable arm. Again, bringing back the patterns of crawling into the nervous system and through these functional patterns of pushing and pulling. Janice will stabilize that left arm as she pulls with the right arm, rotating the trunk and the thorax around that stable left arm. It's a great way to develop serratus and scapular stability in that left arm and then improve trunk rotation around that right arm that's moving. Now I'll have Janice go into a pushing pattern. Similarly, she'll stabilize the forward arm. She'll go into a split stance position and then she'll perform a pushing motion. Again, she's pushing and rotating the trunk around a stable arm. Again, we're trying to recreate many of the patterns that you'll see in infant crawling with the arm stable and the spine moving around stable limbs. Janice will do a couple more repetitions. And as we finish up here, again, we'll review. We did breathing to begin, to loosen up and mobilize the thoracic spine. Then we did quadruped trunk rotations to create specific rotation around the thoracic spine. And then we'll finish up with pushes and pulls with one arm stabilized and one leg stabilized to create trunk motion around stable limbs, which will build in the functional and neurological patterns from crawling and develop a more upright functional position in which to improve trunk rotation. This is Dr. Evan Osar with Fitness Education Seminars. Have a great day.